Hi everyone. In this video, I'll be talking about skin tags. In the initial part of the video, I'll be talking about what are the features of skin tags, what are the causes, how to differentiate it from warts, how to prevent it, the treatment aspect, do any creams work on skin tags, home remedies, and finally about recurrence. Myself, Dr. Kiran Casey, I am a dermatologist working in Haldwani, Uttarakhand. Let's start. Let's start with what are the features of skin tags. Skin tag is skin colored, smooth surface which occurs in the folds which are soft to touch. Okay, folds matlab particularly axilla, in the groin, below the breast in females, neck. Most of the time, these skin tags are associated with acanthosis nigricans, okay, which is thick, darkened skin, usually skin on the neck and the axilla. If you want a video on acanthosis nigricans, please mention in the comment section. I'll make a video next time. Okay. So it is usually seen in after 30 to 40 years of age. Both males and females are equally affected. 60 to 70%, okay, almost 50 to 60% of the individuals at least develop one skin tag in their lifetime. Okay. Now let's understand the causes, okay, why you develop these skin tags. One is it's due to the frequent friction, particularly in the folds. Frequent rubbing can cause this skin tag to develop. Second is genetics. Okay, if your parents have skin tags, okay, if your people in your family have skin tags, there's every chance of you developing skin tags in your lifetime. The other causes are obesity, insulin resistance, particularly in diabetics, hormonal disorders such as PCOD, thyroid disorders, metabolic syndromes such as Cushing's. Now, what is the most common differential diagnosis is warts. Usually you find it difficult to differentiate from warts, okay, which usually the warts which are seen on the face and the neck, okay, usually find it difficult to differentiate. So let's understand what is the difference. Okay, the first and foremost, the difference is what has an irregular and rough surface, okay, whereas skin tags, as I already mentioned, is a smooth surface. Skin tags are skin colored, whereas warts can be lighter or darker in color. Warts are developed due to virus, okay, human papilloma virus, but a skin tag is not an infection, okay. Since warts is an infection, there is every chance of it being communicable. It can spread from one person to another, and also new lesions, okay, which can the lesions which are existing, it can rapidly grow, okay, become bigger also, and many new lesions can be developed, particularly if the wart is present in the beard area. Since you frequently shave, it can spread the whole area, okay, it can develop wart. Whereas skin tag is not so. It's slow growing. It does not rapidly develop, okay, no, it's not like rapidly growing in size. It's not that many new ones are coming. No, it's a slow growing lesions, and it does not, it's not a communicable disease. So what, since it's an infection and it's communicable, it has to be treated, okay. Whereas skin tags is a cosmetic problem. You can decide if you're okay with having a skin tags. If you're not getting it treated, that's fine, okay. So if you have any doubt, okay, if any skin tags is present in your neck, then it's always best to visit your dermatologist, and if your dermatologist feels it's a wart, get it treated, okay. So it's better to visit a dermatologist if you have any kind of doubt, okay. Now prevention. Okay, for prevention, lifestyle changes is very much important. You should regularly exercise, reduction in sugar and high carbohydrate rich food. Better to take a healthy diet, particularly food which are rich in proteins. Okay, lot of fruits, lot of green leafy vegetable which are rich in antioxidants. Okay, because these calorie rich food or carbohydrate rich food or sugar rich food, this can make insulin resistance to develop. Okay, and you can develop particularly these skin tags. Okay, and now we have prevention, we have discussed. Let's discuss the treatment aspect. Okay, particularly if it's a cosmetic problem. Okay, if it's not causing any problem to you, it's not irritating you, particularly skin tags which are in the axilla, which has the neck or a peduncle, which are senile skin tags, okay, which are hanging, this can keep on irritating you. Okay, in that case you can get it removed. So always it's optional. If you leave it also, no problem, it happens. Okay, you can skip the treatment also. But if you want, if it is irritating you, these small lesions, okay, skin tags, you can get it treated. It's a very simple procedure. Okay, in this electrocautery or radio frequency is used. Okay, and the base of the skin tags are ablated off. Okay, after ablation, and the skin heals normally without leaving any scars or pigmentation in most of the cases. Okay, it's a very simple procedure, but always get the procedure done from a dermatologist. Okay, because these quacks may not be knowing how to exactly do the procedure and give a very bad mark, okay, or a scar. Hardly it will take 2-3 minutes to remove a single lesion. Okay, so depending upon how many lesions you are developing, which all you wanted to get it removed, always you can get it removed. Simple electrocautery or a radio frequency, it will do the work for you. Okay, so now, do any creams work? No, none of the creams work. Okay, you can't get rid by just application of some creams. I know in YouTube there are a lot of people saying use that cream, this cream. No, none of the creams work. It's a very simple procedure. You can visit your dermatologist. Okay, it is easily can be removed. Okay, no procedure is required, no cream is required. Okay, and no creams work also on this. Okay, home remedies. Some people tie thread to it. Okay, some people burn with agarbatti. Even I have seen few of the people use that horse hair from the horse tail and tie it. Okay, so look, none of these procedures work, particularly if you're going to tie a thread or a horse tail hair to it. In some cases it may fall off, but in most of the cases it can increase in size, it can necrose, cause redness, sometimes cause infection. Particularly burning with agarbatti can leave a bad mark or a scar. So don't go for these all home remedies and get yourself pigmented or scarred. Okay, so simple procedure. Please visit your dermatologist. Okay, now finally, what about the recurrence component? Okay, now from the recurrence component, particularly lifestyle changes, I told already. If you regularly exercise, if you avoid high sugar rich food, calorie rich food, surely you can avoid. Okay, avoid new skin tags from developing. Okay, if you don't make these changes, there's every chance after 1 or 2 years, if these lifestyle changes are not made, then new lesions might develop. Always concentrate on regularly exercising, reducing your weight, and having a healthy diet, as I mentioned in the prevention. Okay, finally, thank you. If you find this videos informative, please like, share and subscribe. Please share with all your people you care. Okay.